All right, today we're going on a journey. It's one that starts with something super common, a little speck floating in your vision, but it can quickly turn into a serious, sight-threatening emergency. We're going to talk about retinal detachment, what to look for, how it's fixed, and the road to recovery. So, let's dive in. You've probably seen them, right? Those tiny little specks or squiggly lines that just kind of drift around when you look at a bright sky or a white wall. We call them floaters. And most of the time, they're totally harmless. It's just a normal part of the gel inside our eyes getting older. But what if those floaters suddenly decide to throw a party?
Okay, this right here is probably the most important thing you'll hear today. Having a few floaters you've known about for years, that's one thing. But seeing a sudden shower of new ones, like someone shook a pepper shaker inside your eye, especially if you're also seeing flashes of light, that's not just a floater. That is your eye's version of a fire alarm, and it is blaring. You just can't ignore it.
So what's actually setting off that alarm? It's a process that's got a fancy name, posterior vitreous detachment, or PVD. And what's wild is that for most of us, this is a completely normal part of getting older. But for an unlucky few, this normal process, it goes wrong.
I love this analogy. Just picture it. The gel inside your eye is like a sticker, and the retina, that super important light-sensing tissue at the back, is the paper of the envelope. Over time, that gel sticker just naturally starts to shrink and pull away. Most of the time, it peels off nice and clean, no problem. But what if that sticker is a little too sticky? Well, if that sticky gel pulls too hard, it can actually rip the paper. It creates a tiny tear in the retina. And this is the critical moment. We're not at a full detachment yet, but we're on the brink. If you get to a doctor right now, they can often just seal that tear with a laser. But if you don't, and fluid starts to get through that hole, the whole situation changes in a heartbeat.
Right, so once that tear is open, the liquid from the middle of the eye can sneak underneath the retina, lifting it up off the back wall of the eye. This is bad. Really bad, because it cuts the retina off from its blood supply, from its oxygen. This isn't just a tear anymore. This is a retinal detachment, and the clock is officially ticking.
This is the classic textbook symptom people describe, and it sounds absolutely terrifying. It's like a dark curtain or a shadow starts to fall over part of your vision. What's so scary is that there's no pain, just this silent, creeping darkness that tells you a part of your retina has just gone offline.
And this is what that curtain in your vision actually looks like to a doctor. The retina, which should be smooth, is lifted up, wrinkled, and peeling away. It's like wallpaper coming off a damp wall. Every single bit that is peeled away is a bit of your vision that's gone dark. This is a true race against time to prevent that vision loss from becoming permanent.
So how common is this? Well, it affects about 1 in every 10,000 people each year. So no, it's not super common, but when it happens, the stakes are incredibly high. And your risk does go up, especially if you're really nearsighted, if you've had a serious eye injury before, or even if you've had cataract surgery.
Okay, so that was all pretty intense, I know, but here is the really good news. Even though this is a huge emergency, modern surgery is amazing at fixing it. So let's head into the operating room and see how they work their magic. Before we get to the repairs, let's just do a quick refresh on the layout here. The whole goal, the entire point of the surgery, is to get that delicate layer, the retina, lying perfectly flat against the back wall of the eye so it can start to heal. And to do that, surgeons have some pretty incredible techniques. So surgeons have 3 main tools in their toolkit. First up, a vitrectomy. That's where they actually go in, remove the gel that caused all the trouble in the first place, and they replace it with a temporary gas or oil bubble. That bubble acts like an internal cast, pushing the retina back into place. Then there's the scleral buckle. This is different. It's a tiny silicone band they put around the outside of the eye to gently indent the wall, bringing it in to meet the retina. And finally, there's pneumatic retinopexy, where they inject a gas bubble to push the retina back. 3 different approaches, but they all have one single goal: get that wallpaper stuck back on the wall.
The surgery itself is just step 1. Now comes the hard part for the patient, because the recovery is where you play a massive role in how well you heal. And let me tell you, it's a long road that requires a ton of patience.
Yeah, recovery is definitely a marathon, not a sprint. For the first couple of weeks, it's all about rest. Your vision is going to be super blurry, which can be really unsettling. Then, around 4 to 6 weeks, things finally start to clear up. But here's the kicker. It can take a full year, or even longer, for your eye to totally heal, and for your vision to be as good as it's going to get.
Following the doctor's orders after surgery is, well, it's not optional. It's everything. If you got a gas bubble, you might have to keep your head in a very specific position, often face down, for days. This keeps the bubble pushing on the right spot. And this next one is life or death important. You absolutely cannot fly in an airplane or even drive to the mountains. The change in pressure will make that gas bubble expand inside your eye. It's incredibly dangerous. That green wristband is there to make sure every other doctor knows about that gas bubble.
So after the surgery, after the strict recovery, after all of that waiting and patience, what's the end result? Can your vision actually be saved? Well, this is where the story gets really, really hopeful.
This is amazing. A single surgery successfully reattaches the retina about 90% of the time. 90%! And even if it takes a second try, the odds are still fantastic. But the final quality of your vision, how well you see in the end, that all comes down to one thing: speed. How quickly you acted when you first saw those warning signs. That's what makes all the difference.
And here it is, the payoff for that entire journey. On the left, you see the emergency, that wrinkled, peeling, starving retina. And on the right, that is the very same eye after surgery. It's smooth, it's healthy, it's lying flat against the back of the eye, ready to do its job again. It is just an incredible thing to see. So when you boil it all down, the takeaway from this journey is so simple. Listen to what your eyes are telling you. A sudden storm of floaters and flashes isn't just a weird thing happening. It's a direct message, a call for help. And acting on that message right away is the single most powerful thing you can do to save your sight. Your vision is precious. So, are you listening?